afternoon, everyone. Welcome to another Facebook Live hosted by the National Kidney Foundation. My name is Tisha Reynolds, Executive Director for the National Kidney Foundation serving Central Ohio. I would like to introduce our panelists today, Dr. Ray Bignall, an Assistant Professor of Pediatrics in the Division of Nephrology at Nationwide Children's Hospital and the Ohio State University College of Medicine, and Dr. Tajed Mohammed, a pediatric nephrologist at Nationwide Children's Hospital and an assistant professor of pediatrics at the Ohio State University College of Medicine. Thank you both for joining us in our discussion on how COVID-19 is impacting our pediatric patients. This is a panelist discussion, and we encourage you to ask questions in the Q&A box or on Facebook.
Well, it's a real pleasure to be with the National Kidney Foundation community today and to address parents, families, patients with pediatric kidney disease and talk about how our current global pandemic is likely to be affecting them. There are a few things that I think it's important for families to know. Number one, I think it's important to know that pediatricians across the country collectively feel a little bit more comfortable now, more willing to breathe a bit of a sigh of relief now than they did 3 months ago, when many of us really started in earnest on this journey, appreciating the impact that coronavirus and the COVID-19 pandemic was going to have on our country and our medical system. So currently, the numbers, while still a little bit hard to get a complete and total grasp of, currently children represent between 2 and 5% of positive tests in individuals here in the United States. What that means is that of all people age from birth to age 18, only about 2 to 5% of the total number of positive cases are children. Of that number, it's a little bit harder to pin down exactly how many of those children have been hospitalized. That actually varies pretty substantially from community to community, city to city. But we do know, based on some of the epidemiologic data, both in the United States and in parts of Europe, that the fatality rate is thankfully, at least as of right now, considerably lower in children than it is in adults. In fact, the highest age cohort of particular concern is right around birth to 1 year, the infancy stage. So that's something that I think pediatric nephrologists feel very, pediatricians in particular and pediatric nephrologists as well, feel very pleased about the current scope of the data thus far. Let's talk about kids with kidney disease. We unfortunately don't have really solid data on how many children with kidney disease have also developed COVID-19. We do know a couple things though. Number one, we know that children with kidney disease seem to be just as likely as those without kidney disease to develop COVID-19 and to be infected by the novel coronavirus. So what that means is while we accept that children, particularly those who have kidney transplants, are on dialysis, or have the sort of kidney diseases that result in kids being on immunosuppressive therapy, we recognize that those children are likely to be at increased risk for contracting the novel coronavirus. Thankfully, of the cases that we have seen and heard about so far as a pediatric nephrology community, it appears that our patients, that their risk of severe disease, like the type you've been hearing about in the news and seeing stories about coming from places like New York, places like Seattle, places like California, it appears that our patients are not as severely affected as those adult patients with chronic disease as well. So as we get into our discussion today, we can talk a little bit more about specifics in our patient population, but that's kind of where I wanted to get started framing our discussion today.
Thank you, Dr. Bignall. And can you go into a little bit more detail about the pediatric patients with CKD, specifically also telehealth implications and the care for those patients that you've seen and you've dealt with?
Yeah, so this is actually probably the way that the global pandemic is affecting our patients the most. While it isn't exactly affecting their health as substantially as we were worried it would be, in the sense that our patients are contracting and dying from COVID-19 at rates comparable to adult patients with comorbid conditions, our patients and families are really dealing with a completely new experience when it comes to navigating care for their children. So what many of you have experienced all around the country is a transition, a remarkable overnight transition from in-person clinical encounters to telemedicine. And telemedicine has been a very new thing for most of us pediatricians as well, and pediatric nephrologists. So we really are thankful to our families for them being so willing to be flexible. Very early on, many hospital systems did not have the proper infrastructure to support the same volume of patients as we have been used to, while also respecting physical distancing guidelines that were necessary to help prevent the spread of the novel coronavirus. So early on, we did a lot of punting, shifting patients out of our clinics, asking them to transition their visits to a telehealth encounter, while we did the work of making sure, number one, that our hospitals had the capacity to support patients were they to get sick and need care in our facilities. But also, number two, to make sure that when patients were ready to return to our hospitals, that they were also ready to accept them. So what does that mean for us? Well, here at Nationwide Children's Hospital, that means that our hospital infrastructure and our clinical infrastructure underwent an overhaul. We have physical distancing barriers that have been put in place when you walk up to register. We have spaced out seats in our waiting area. We have special protocols for patients and families when they come to see us in clinic, when they go to get labs, when they come to the dialysis unit, all meant to help keep our patients and families safe. Another thing that's important to realize is that children, while they themselves may not be as prone to the severe illness manifestations that a lot of chronically ill adults are prone to, they could still get adults in their family sick. And unfortunately, we know that many of our patients really are not able to physically distance from mom, dad, grandparents, caregivers. And so we want to keep those individuals safe too, because keeping them safe is going to help keep our patients safe ultimately. So we want to make sure that these physical distancing and infrastructure changes are in place, not just for our patients, but also for their families. By and large, we have had very positive experiences with telemedicine. We can talk a little bit later, perhaps in the Q&A, about how telemedicine is being integrated into not just the care of children with pediatric kidney disease, but quite honestly, the care of adults and children all over our country, and how it's probably here to stay. And in knowing that there's going to be some adjusting for us as providers and for families to get used to. Maybe some of the visits I have with my doctor are going to be on my phone via Zoom or Skype, and then some of the visits that I'm going to have are going to be in person too. So many families have learned how to navigate this system. I care for a lot of patients who come from rural parts of my state, Ohio, some who come from inner city parts of the city where I work, Columbus, Ohio, here in the capital of Ohio. And these families, both of them, can have challenges connecting using telemedicine, a phenomenon we call the digital divide. This is an area of particular concern for me and hundreds of my colleagues here at the hospital. We're all working very hard on helping to ensure access for our patients as well. So a lot of changes that come with telemedicine, but ultimately we hope that it's going to provide increased access for our patients and allow us to integrate more seamlessly the physical distancing guidelines that we're being encouraged to have, and protocols we're encouraged to have by our healthcare system and our healthcare teams.
Great, thank you for that. Dr. Mohammed, you helped create the new guidelines for acute and chronic dialysis during this pandemic. Can you describe what those procedures are and what you are currently experiencing in the dialysis unit?
Thank you very much for having me this afternoon. Thanks, Tisha. Particularly our patients on dialysis, they are vulnerable. And during this pandemic, our goal has been to make sure that we deliver the optimal patient care as well as maintain our patients safe. And that has been quite the balance to keep during the pandemic, especially for our hemodialysis patients. So we have the two modalities of dialysis. We have the dialysis that you can do at home or PD, and then the in-center dialysis or hemodialysis. So this particular type, the hemodialysis type, is particularly worrisome to us because patients will have to travel from home. They cannot, apply the stay-home orders. They have to travel at least 3 times a week to come to the dialysis center to get their treatments, which is very essential for life for them. So we modified our hospital policies and guidelines to ensure that these patients will get their treatments as well as avoid spread and infection with COVID-19. So to that end, we worked on transitioning patients early to home dialysis. Rather than having them come to the center, patients who are eligible to have home dialysis, we started working on that. And for example, usually our wait time for patients to start home dialysis after they have their surgical procedure and they are ready, usually we wait for 2 to 4 weeks for them to recover from the surgery, their body to heal and be ready to start dialysis. So what we did is we shortened that interval from 2 to 4 weeks to 1.5 weeks so that we can get these patients starting dialysis at home rather than coming to the center. We also, patients who really needed to continue their hemodialysis in the hospital and come to the unit, we lessened the frequency of their treatment. So patients who required 4 treatments a week, we rather did a longer treatment and changed it to 3 times a week so that they have less travel and they have less encounters in the hospital and with other people that might put them at higher risk of encountering COVID-19. And as Dr. Ray mentioned, we have been utilizing telehealth. That has helped a lot. So these dialysis patients, as you know, they will need frequent follow-up, frequent labs. Some of them, especially the younger ones, need lab every week. They need a visit every week. So we utilize telehealth to make sure that we follow up on our patient because we wanted to make sure that they would not come to the unit as frequently to lower the amount of exposure. We also kept patients who are on home dialysis at home as much as possible. They will need to come to the dialysis unit every month, but we requested that they can do their visits, their monthly visit via telehealth as possible to make sure that, again, we decrease the risk of exposure for this particular population. So the patients who need hemodialysis and really needed to come to the unit, we kept them in the unit and we saw them, again, with the general precautions of maintaining social distancing, wearing PPEs for patients as well as for providers, and we kept seeing them in the unit. Our younger babies and infants definitely needed to come to the unit to be seen, even if they were at home dialysis, because again, they are very sensitive, very vulnerable. We wanted to keep an eye on them at least once a month. But to that end, we tried to coordinate their dialysis visits with other appointments that they have for other reasons, so that they are traveling less frequently for these appointments and they're traveling less frequently for labs and so forth. So that's in relation to the chronic dialysis or long-term dialysis. We also have this procedure called the continuous renal replacement therapy or acute dialysis that kids and infants, usually very sick in the ICU, need this type of treatment. It is particularly sensitive treatment that occurs over 24 hours, requires intensive monitoring during that prolonged continuous 24-hour dialysis, we worked in collaboration with our ICU teams and ensure that if there is a patient who is suspected to have COVID-19 or does have COVID-19, that the nephrologist will work in collaboration with the intensivist and the cardiologist to make sure that we minimize the contact for our teams and for the patient by collaborating with the primary team to tell us about, for example, degree of fluid overload, degree of the support that this patient needs. And these guidelines came actually from the American Society of Nephrology, that for this particular population, we can collaborate with other teams to decrease the amount of exposure.
Great, thank you.
Welcome.
Moving on from dialysis and transitioning to transplant, Dr. Bignall, what are some concerns of parents that have children that received a transplant? And if you could really speak upon what are those risks for transplanted patients? And then also, what is the risk for participation in summer programs if they're offering them in their area?
Yeah, so this is a really excellent question, and we're getting a lot of these questions right now. So couple things to know. First of all, there's very little like solid research, large scale studies on exactly what's happening with children with kidney transplants and COVID-19. This is kind of a general theme in pediatrics in general, but especially in pediatric kidney disease. Thankfully, pediatric kidney disease is relatively rare. And though these patients are particularly high risk and near and dear to my heart and Dr. Mohammed's heart, we definitely are grateful that our patients are not showing up in the roles of those who are very ill with coronavirus. So a few things to know. Number one, of the studies that have been done, they've been relatively small in number. And even those children in Wuhan, China, in some studies that came out of there, those from a European registry as well, both of these studies, thankfully, have not shown that children, even those kids on systemic immunosuppression, so think about kids with kidney transplants, but also think about kids who have nephrotic syndrome and might be on steroids, or kids with other kinds of glomerular conditions like lupus nephritis, or IgA nephropathy, who might need immunosuppressive medications. Even these children who, the small number of them who have gotten the novel coronavirus and developed COVID-19, their symptoms course has been very mild. So that's good news. Again, we sort of don't want to get too excited because these studies are relatively small. They're in regional populations. And might not be incredibly generalizable. You may remember hearing about little subtle differences in the populations of people who were getting sick in the cohort of adults in China versus the cohort of adults in the United States. And the reason is that different populations in different parts of the world experience disease differently. So certainly we are all being very careful when we think about the information that we're getting about kids with kidney transplants who get COVID-19. But so far, we're encouraged by that data. So that's the first thing. The second thing to talk about is the overall risk and how to reduce the risk of kids who do get COVID-19, kids who are at risk of getting COVID-19 from acquiring it, okay? So number one, those patients who we know have developed the novel coronavirus and COVID-19, those kids actually, while they may be hospitalized, their level of hospitalization isn't as severe as many adults, okay? So several of these kids may end up hospitalized, and unfortunately, the data is too limited to be able to generalize a percentage. But of those kids who are hospitalized, we can say relatively safely that those kids are not at significantly increased risk of developing severe disease than those other children who get COVID-19 who are not kidney transplant recipients and are not on immunosuppression. All right, so that's thing number one. Thing number two, let's talk about how to prevent these kids from getting sick. Because as a pediatric nephrologist and someone who takes care of transplant patients here at Nationwide Children's Hospital, I am really excited by the fact that these kids don't seem to be getting sick with severe COVID-19. I definitely don't want that to change. So what can we do as our country starts to open back up to ensure that kids stay safe? And the answer, we're going to sound like broken records today. The answer is basically what you've been hearing us talk about for the last 3 months. Physical distancing. Stay 6 feet apart at least from others. To be perfectly honest with you all, there is a lot of evidence that suggests that certain kinds of respiratory droplets can travel even farther than 6 feet. So this is actually the reason why the Centers for Disease Control, now that we know that there is an appropriate supply of personal protective equipment in many locations, not all, but many locations around the country, this is why the Centers for Disease Control is encouraging Americans to wear face coverings when they go out in public. Remember, when you wear a face covering, you are wearing it to protect others, not yourself. So when I wear my face mask, and I have mine right here by my desk. So when I wear my face mask, I am helping to prevent the droplets coming out of my mouth and my nose from aerosolizing. That means getting into the air, the atmosphere, and possibly getting someone else sick if I have the novel coronavirus and just don't know it yet because I haven't developed symptoms. And so when all of us in a community decide that we're going to wear our masks together, what we're doing is we're saying that we're going to protect everyone. All right. So we want your children, if they're older than age 2, we want them to wear their masks. And we want all of the members of the family, and ideally everyone you come in contact with at the grocery store, if you have to go there, or if you have to go out with your family for some other reason, we want them to wear a mask too. All right, that's number 2. Let's be covered and be protecting ourselves. We should also recognize that it's really important to avoid large groups. All right, so you guys who have children who have kidney transplants, or perhaps you're an adolescent or young adult who has a kidney transplant yourself, you may remember that right after you got your transplant team told you for the next several weeks, you cannot go out in front of crowds. And, that's really tough. A lot of people want to get back to school. They're excited they finally got their transplant. Finally, they can start eating foods with phosphorus and potassium in it again. And they want to go have fun with friends and family. Can't do that so soon because the amount of immunosuppression that they have on board means that they're at particular risk for contracting a virus, any other virus that could get them sick. Now that we're in the middle of a global pandemic, those rules apply again. So we really, really, really want families to avoid large crowds. We want to make sure that, and that includes, unfortunately, school. It includes, unfortunately, summer camp. And that stinks. I know a lot of my patients were really looking forward to summer sports, and where those summer sporting programs haven't already been canceled or maybe are opening back up, I would recommend, and most members of the kidney transplant teams at most kidney transplant centers around the country would recommend that until we get a better sense that the number of cases in the United States, which have started, unfortunately, in a lot of locations to go back up, until we get a sense that those cases are trending down and consistently trending down, and you get the all clear from your transplant center, we're going to tell you that you should probably stay home and avoid large crowds. So physical distancing, at least 6 feet apart, cover your face, avoid large crowds. The last thing I'll say, in the event that one of your patients, God forbid, were to develop the coronavirus and COVID-19, it's important to have a conversation with your transplant nephrologist, even if your child is not that sick. So there are a lot of guidelines about what to do with people in your home who get sick with COVID-19. We can talk about those later in the Q&A if there's interest. But one of the really important things I want everyone listening to know is that if your child is on immunosuppression, either for a kidney transplant or some other kidney disease, and they develop COVID-19, and the COVID-19 treatment team at your child's hospital wants to start them on a medication, be sure that they have a conversation with your nephrologist in order to discuss the risk of being on their immunosuppression for their kidney disease and getting another kind of medication for COVID-19. There are several, particularly antiviral medications that use the same enzyme system in the body that is used by some of the other medications called calcineurin inhibitors. These are medicines like Prograf or cyclosporin or Astrograf that our patients need to keep their kidney transplants working, but can have changes in the dose level when they're treated with other medicines for COVID-19. So those four things I think are really important for our patients to know.
Great, thank you. Dr. Mohammed, are transplant surgeries taking place in pediatrics? So, and if you could, what's the status on those elective surgeries, and also the status of surgeries that were postponed due to COVID-19?
That's a wonderful question. So for the exact same reason that Dr. Bignall mentioned about transplantation, during the peak of the pandemic, we have postponed all living donor transplant surgeries because those transplants involve strong suppression of the immune system, and they make people more vulnerable to encountering the infection. So we postponed the living donor transplants during that time, and all of the elective procedures like kidney biopsies, for example. We have also a few patients on the disease donor list that needed transplant, and some of them have been waiting for years. I'm sure you totally understand how these patients are just waiting for the opportunity to get a kidney transplant, who have been on dialysis for many years, and here we're talking about kids. So for those particular patients, even during the peak of the pandemic, we left the disease donor list active, and we said it's going to be a balance depending on the type of the kidney that we might get and the patient and everything. And again, we have been doing a lot of weighing on this to make sure that we don't, we don't just not take the opportunity for these particular patients who are waiting for a transplant versus not exposing them to immune suppression and encountering COVID-19. So recently we have restarted our transplant evaluation, and we are doing that in collaboration with multidisciplinary team for transplantation, not only physicians, but registered dietitians, psychosocial workers, and as well as our social workers and our transplant coordinators. So we restarted that program, and as you can imagine, we're doing it partially in person as possible to see these patients and start the evaluation, and we're doing some of that also via telehealth, especially for our multidisciplinary evaluation team. For kidney biopsies and for other procedures that we do, the same applies, same concept. They were all postponed during the peak of the pandemic, and we're now restarting slowly on these procedures, especially for patients who are top priority to get these procedures that can, especially if we're looking at diagnoses and management options that will change their treatment course if we're dealing with something like severe glomerular disease or a kidney transplant, possible rejection. So we're doing that to make sure that these patients will receive a timely care during this pandemic. For the living donor transplant, we actually have a few coming in the next few weeks, and we're hopeful that as long as things are stable, these patients will still be able to get their transplant in the next few weeks.
Great. Dr. Mohammed, many parents seem to be more stressed by the new environment in which they are working in. Summer schools are now being taught from home. In some areas, summer camps have been closed. Are there any suggestions for parents who may be struggling to find ways to keep their children busy while working in this new environment?
Tisha, this question actually relates to me personally. And myself and my husband have been working from home full time during the peak of the pandemic, and we had also to help our 3 kids with their schooling and everything else when they were out of school doing e-learning and also wanted our help with their homework and everything. So I understand this is a very important aspect of the pandemic to a lot of families. And we personally have gone through taking the time to making sure that we do the necessary steps to ensure our mental well-being as we do all of that together. So what we found helpful is that particularly for parents to make sure that we take care of ourselves first. Because if we want to be able to support our kids and support our patients and families and everyone else, we have to first take care of ourselves. And what we found helpful in that regard is exercising every day. And I know sometimes 20 minutes can be a lot of time if you are taking it from 24 hours and not from 48 hours. So that in particular has helped a lot, taking those 20 minutes. And I will be open. Sometimes I took those 20 minutes to exercise at 9 p.m. So that has been really helpful. And I can relate with parents and families who find it challenging to find time to take care of themselves because they're always taking care of someone else. I also find it helpful to stay in contact with your close friends and families. Contact them maybe on a daily basis, calling them, just making sure that you talk with them about your concerns, adults' concerns, sharing that with them will be extremely helpful. As well as journaling and taking notes of what you do as a parent. One positive thing a day, I call it. I found that also encouraging to do on a daily basis, because sometimes we get into this feeling of guilt and blame that we're not providing for our kids because we're doing other things. So one positive thing a day that you're doing as a good parent, and that will keep growing hopefully and fill us with the sense that we are still staying on top of everything during this pandemic. For kids, I think the website for the American Academy of Pediatric is very resourceful, and it has a lot of resources for families and for kids. And actually, it is wonderful because it is COVID related and it goes by age. So it has resources and activities for each age group. For kids, talking about healthy living, what is the good nutrition when everyone is home and not that active. Well, now a little bit people are getting more active, which is great. But nutrition, fitness, and sports, how to do sports if you are going to be engaged in those classes. And then also it has resources for safety and prevention of transmission of the disease, which is awesome. And then talking about family life in general and balance between work and play and school and all of that, I find the AAP website, which is healthychildren.org, is really helpful and resourceful. And it also has information about different health issues. I recommend that our families visit that website. They will find it helpful.
Great, thank you. I'm gonna, Dr. Bignell, I'm gonna ask you the same question.
Yeah,
and
I'm excited
I
to answer.
appreciate this input. I'm also a parent with 3 children, so I empathize with this question. So I look forward. Dr. Bignell, what is your advice regarding helping with parents cope and manage during this time?
Yeah, so this is a question that's near and dear to my heart too, because one of the things that's been really exciting for me personally here at Nationwide Children's is that we have a really innovative team. We've developed this team we call the Psychosocial Power Team. It's made up of psychology and social work and dietitians and our hospital-based school educators and therapeutic recreation. And these wonderful team members have been able to partner with our kids in the dialysis unit, in our transplant clinic, and really help them to cope with so many of the changes that are happening. Having a child with chronic kidney disease is hard. Having a child with end-stage kidney disease is even harder. And so you put on top of all of that, these new stresses of new procedures and protocols when you go to the hospital, new procedures and protocols when you go to the dialysis unit. Just like my colleague, Dr. Mohammed, was saying, the challenges that families now are having to carry with school and just being around your kids all day long. Like these are really tough times for a lot of families. And so having a team in our hospital who provides care, psychosocial care to patients with kidney disease specifically, and who are trained in this, and they understand what the families and what our patients are dealing with, is really so crucial. So I wanted to really shout out the psychosocial power team that we have here at Nationwide Children's, and encourage our viewers, our audience, ask your pediatric nephrologist. If you don't already see a pediatric psychologist as part of your regular practice, if you're not already engaged with the social work team, if you're not already engaged with your dietitian and some of the other team members who are there at the hospital, I absolutely encourage you to reach out to them. The other thing I wanted to mention is that there are some really terrific organizations that are partnering with families every day to help provide outlets and ideas for how to better care for kids with kidney disease. One of them is the National Kidney Foundation. The National Kidney Foundation does awesome work. There's tons of resources online that help families navigate the experience of having a child with kidney disease, and tons of resources that talk about coping. The American Academy of Pediatrics, like Dr. Muhammad said, is another really great resource. I also want to mention a resource that a lot of families around the country are getting to know more. It's called the Improving Renal Outcomes Collaborative, or Iroc. Some of my friends down in Cincinnati and other parts of the country have started this organization. Nationwide Children's is proud to be a member, as well as several dozen other pediatric kidney programs and kidney transplant programs all over the country, and in a couple other parts of the world too. And so it's really exciting that there's so many really great organizations that are standing at the ready to support families. Many of these organizations, just like the NKF, just like Iroc, just like the AAP, have already had outreach programs to families. And so when this pandemic hit, they were ready to go, just like that, to mobilize on behalf of families and our patients. So avail yourself of resources. Don't allow yourself to sit in a silo and deal with the stress and uncertainty of having a child with kidney disease and what to do. There are a lot of great resources, frequently asked questions. In fact, the Improving Renal Outcomes Collaborative, also known as Iroc, their website has some really great information specific to children and families with kidney transplant and other types of solid organ transplant that I would encourage folks to look at. So just a really great group of folks, great group of people all over the country who are working really, really hard to make sure that our patients and their families are supported right now.
Great, thank you. I think we're going to go to our audience now for questions. So Michelle from Facebook asked, what is the risk for sending siblings to summer camps or schools coming up in the fall if recently transplanted a 5-month child is at home? Dr. Bignall, can you answer that?
Yeah, so, I'll caveat all my answers by saying that, my advice is based on the question, and I'm going to do the best I can to answer the question as best as I can. But I encourage you definitely to talk to your own child's pediatric nephrologist. But this is kind of how I would frame it and think about it. So you need to recognize, as much as we would love all of these awesome experiences, having our kids and families go to camps and be involved in summer sports and all of these exciting things, going on vacations and stuff. That's what summer is all about. But unfortunately, in this current environment, in the middle of the pandemic, we have to recognize that anytime anyone leaves their home and goes out into the community, they are exposing themselves to an uncertain world. Okay, so when you allow your kids to go and interact with other children, remember that a significant number of children who have the novel coronavirus may not have any symptoms at all, or the symptoms that they do have may be pretty non-specific. Okay, things like a runny nose or a little bit of a cough or some belly pain. All right, they may not all have a fever. So it's really important to know this, because you could be sending your child out into the community where they could bring the disease home with them. And while they themselves might not develop any symptoms, while the risk seems to be not so much higher than the risk in other kids, we do know that because our patients are immunosuppressed, we want to do whatever we can to protect them. Because those are the patients, if something bad is going to happen, it's going to happen in this population of kids, the ones who have chronic diseases and who are on immunosuppressive medications. So my personal recommendation, as hard as it is for me to say this, is that it's probably a good idea to limit our exposures on the outside, especially things like summer camps and summer schools and summer programs and things like that.
Okay. So as we know, many schools right now are getting ready to make decisions on what the fall will look like. Chris on Facebook asked, what are your thoughts about returning to school for a child in stage 3? Dr. Mohammed, could you speak to that?
Yes, this is a very important question to all of our patients with chronic kidney disease. I know there is ongoing discussion at the levels of the different states and school districts about whether we will be able to have full-time at school or part-time schooling or full e-learning. So I would say that the decision that the officials will make regarding whether kids are safe to go to school or not, I think that's going to be the important decision for us, because we see only the kids with kidney disease, but they look at the whole big picture for the state and for the safety of everybody. So from what I hear that if we go into part-time schooling, I see that kids will maintain social distancing in the classroom as well as in transportation. So I would say that probably that's going to be safe since it's coming from the officials, and especially here at the state of Ohio, our officials have helped a lot during this pandemic, and they kept people safe. So I would say follow that, number one. And then number two, for kids with stage 3 chronic kidney disease who are otherwise not on immunosuppression or medication that will make their immune system very low, those kids should, and again, with the caveat that we have very limited data on patients with kidney disease, those kids don't have more than the average kid's risk of encountering COVID-19. And if they did, the outcome is not as severe as in adults. Again, these are very limited studies, less than 5 or 6 articles on pediatric COVID-19, and maybe 1 or 2 in pediatric transplants and kidney disease. So I would say follow the pattern there. And I know if we have part-time schooling, we'll still have the option in some school districts to do full-time e-learning. And I know some parents will prefer that, which is if they are able to do it and that makes them feel better about their kids, sure.
Okay, great. So Shelly has asked us a question, and she's speaking from a grandparent's perspective, which I'm sure lots of grandparents are feeling the same way. She would like to know, when would it be safe to see her grandchildren, and speak to 2 different parts, grandchildren or a child that has been transplanted, or her herself that has been transplanted. What's the risk there? So Dr. Bignall, can you answer that?
Yeah, I'll take that one. Oh man, this one hurts so much. So I love my grandparents so much. I actually have a grandmother who, unfortunately, we recently had to place her in a nursing home. And she's lived in South Florida for almost 50 years. And we had to place her in a nursing home down there. And it is so hard because I want to go see her so bad, but they have locked down this nursing home. They're not letting anybody in there. And so I feel my grandmother's pain when I talk to her on the phone, and she talks about how desperately she wants to see us and she can't see us. And we've been trying to do the FaceTime thing, but there's only so far that will go. And for those of our community who are at home and are grandparents and they're looking forward to seeing their grandkids again, this is a real challenge. So the answer is, just like I mentioned before, anytime you bring someone from outside your home, so that means if your grandkids don't live with you, they live outside somewhere else, anytime they come into the home, you have to remember that they're bringing with them the exposures from out in the community. And as well-intentioned as these grandkids are, it's going to be really hard, especially for some of the young ones, to maintain appropriate physical distance. So my recommendation would be, knowing that grandparents and loved ones really, especially right now, we're in the middle of a really stressful time, everybody wants to be together, right? Probably the best advice I could give you is that it might have to be a very well-coordinated, socially and or physically distant. I'm trying to get away from using the term socially distant because I don't think any of us need to be socially distant right now. Physically distant. We need to be socially connected and physically distant. So trying to sort of coordinate rather a physically distant visit. So that might be going to a park, a large outdoor space, and making sure that you interact with your loved one at that appropriate distance, which can be really hard because who doesn't want to hug grandkids, and which grandkids don't like hugs from their grandparents? Even when you're 33, you want hugs from your grandparents. But still, it's going to be really important if we want to keep, especially the older members of our family, safe, that we avoid the physical breaking that physical distance rule. It's also important that we wear face coverings when we interact, especially when we're interacting with people outside of our family. You know, as the country opens up, we've got to come to grips with the fact that people are going to want to see one another again. And we pediatricians and pediatric nephrologists, we're not stupid. We know that families are going to try to start connecting and interacting. So our recommendation has to be the same. We can't adjust or alter our recommendations because it's tugging at our heartstrings as much as it hurts us. But it's really important that you know the principles. Wash your hands, physical distance, wearing a face covering at all times when you're interacting with one another. These are the things that are going to help to keep both our children with kidney disease and our loved ones, especially our loved ones who are higher risk, those who are senior adults, especially with chronic conditions. This is what's going to keep them safe.
And to go off of that, Dr. Bignall, the people, as we're talking about returning to school, lots of people have had discussions about face masks versus face shields. Can you explain, well, one, which one that you prefer or where you think we're headed to for safety reasons?
So this is a great question. So if I understand the question correctly, I would define a face mask or face covering as a cloth of some kind, a cloth barrier that covers the nose and mouth, okay? And I'll explain in a moment why that's important. And then a face shield is, say, special goggles or a special hood that covers the face. Typically speaking, a face covering or face mask is all that the Centers for Disease Control and Prevention have recommended for safe interaction or safest interaction out in public. Face shields you might see being worn by your kidney care team when they come to see you in clinic, or if your child has to be hospitalized, you'll notice a lot of doctors, in fact, probably all over the country, are wearing some kind of face covering all throughout the hospital, and also wearing some kind of eye protection as well, because we know that we are coming in contact with patients who are sick. And one of the ways that, in fact, probably the primary way that folks get sick is through aerosolized virus. That means virus that lives in little tiny droplets of moisture, usually that come out of our mouth when we breathe or talk or laugh or eat. There's also some evidence that these aerosolized droplets can happen in other places too, kind of unusual places, for instance, like bathrooms. patients who use bathrooms or individuals who use bathrooms, they can have, when you flush the toilet, for instance, you can aerosolize virus that way as well. So wearing the face mask, remember, that is designed to protect you, or excuse me, to protect others from sharing those particles, those aerosolized particles with other people. The face shield rather is probably not necessary in most regards, but I would defer to what local officials are recommending. Just like Dr. Mohammed said, as schools open up, if the school system is going to start recommending the face shield as well as the face mask in order to accommodate children being in an enclosed space like a classroom, then I could understand that being the case. Most of the time when we're out in public, the face mask is all that's recommended currently.
Okay. And Dr. Mohammed, Kathleen has asked us on Facebook, how will the spike in cases in several areas impact the plans to move forward with transplantation, which I know is a fear for many parents that are waiting right now? What are your thoughts?
Yeah, this is a very important question. So here at Nationwide Children's, because we have been, under good control in terms of the cases of COVID-19 and our screening procedures and everything else, and the protocols that we implement for patients who are coming for transplant evaluation, for visits, for any hospital visits. We have screening tools, we have policy that every patient who's coming to the hospital to wear a face mask, as well as visitation policies. So this is why we are moving forward with transplantation, as well as educating our patients about risk for encountering the virus. What I see is that it's going to be a case by case and hospital by hospital, depending on what they see in their local area and the trend of COVID-19 pandemic in that particular area. Because in some states now we're seeing stable number of cases. However, in other states, unfortunately, we're seeing again, there is more cases occurring. So I envision that to be as a hospital by hospital decision, as well as the city, the state, and the region, depending on the number of cases in that particular region.
Great, thank you. I know we've talked a lot about younger children. However, Lori on Facebook asks, how about young adults who are post-transplant? Do they do well if they get COVID because they are young? She has a 23-year-old daughter, which is 3 years post-transplant. Dr. Bignall, can you speak to that?
Yeah, so the best data that we have currently says that not only do older adolescents do better of those children, pediatric patients within the pediatric age range, so from birth to 18, 19 years, not only do older adolescents do better than very, very young infants, there is some emerging data now, as I mentioned earlier, that seems to suggest that young adults, in particular, like older adolescents and young adults, seem to have a more mild disease course than, on average, than their more senior counterparts. So the senior citizens in our community, those who are in convalescent or nursing homes, etc. There are some differences, though. For instance, we've heard a lot made of the health disparities that we see in those individuals who are getting sick with COVID-19. In particular, African American and Hispanic and indigenous populations, especially actually Native American, indigenous populations. We find that these individuals are getting the novel coronavirus more commonly, and then their disease course is actually worse. I actually saw data just this week that showed essentially African American individuals who get coronavirus and develop COVID-19, that they, depending on what age bracket they're in, that they actually can have a disease course roughly as severe as non-African American individuals of the age bracket higher. Okay, so I apologize for not remembering the specific numbers, but if you just think with me for a moment that individuals who might be in the young adult range might have a disease severity, who are those individuals who are African American and Hispanic, might have a disease severity that's roughly similar to individuals in who are non-African American or Hispanic in the sort of middle adult range. Okay. So there are some differences, and for this very reason, not to mention, we've seen states like Texas and Florida that have recently opened up their societies and have done so relatively aggressively compared to other states like Ohio and other states around the country. We have seen cases in those communities really skyrocket, and there's a lot of reports in the news media currently, for instance, about Houston, Texas, where they have almost reached their ICU capacity in the city, the fourth largest metropolitan area in the United States. So we really do need young people to still be careful. Again, wash your hands, physically distance, at least 6 feet apart from others when you're out in public, and wear a mask. Very important for all of our individuals, especially those with kidney disease.
Great, thank you. And Dr. Mohammed, we received a question regarding clinical trials. Do physicians have any reluctance to having their pediatric patients participate in clinical trials, especially during this time?
This is an excellent question, actually, and it's a tough one as well, because generally speaking, even before the COVID-19 pandemic, involving pediatric patients in clinical trials is a little challenging because the way they handle these new medications is different from adults. And it's not just because of smaller size, it's because of different handling of these medications and different metabolism and processing. So I would say, and Dr. Bignall, you can also help me with that, that these patients, especially pediatric patients with kidney disease, are more vulnerable than other populations. For example, healthy pediatric patients, more so also with adults. So if we have clinical trials that at least can show us these medications are safe in adults, then we can safely say, okay, from a safety standpoint, maybe it is okay to try these medications on healthy pediatric patients before we bring them to our, kidney disease patients. And if this particular medication, for example, is to treat COVID-19, I would say I personally would prefer to see some healthy and safety data in adults before we try these medications in pediatrics, out of precautions and out of safety concerns for our pediatric patients, especially in the kidney disease population.
Yeah, I would agree completely with you, Dr. Mohammed. I feel like there's kind of maybe two parts to this question. There's thinking about medications and therapeutics in the realm of treatment for COVID-19. There's also thinking about clinical trials of vaccines. I know there's going to be a lot of interest as more vaccine trials become available and folks want to vaccinate their kids against COVID-19. And right now, the honest and short answer is that there's a lot of activity, but not a whole lot of solid data on what's safe. And look, I'm really like a mama bear when it comes to my patients. I want to protect them. And so I definitely, just like Dr. Mohammed, I really want to see some data, some safety data in kids without kidney disease before I know what to say to families of patients who have kidney disease. And so I think it's going to be really important for all of us as providers and for families and parents to really be thinking about the information that they're getting, where they're getting it from, and be discriminating. Talk to your doctor. We spend a lot of time thinking about these things. We're reading about them constantly. We want to be able to provide the best information to our families. And so I really encourage you, talk to your nephrologist and your nephrology team and get some solid answers before you make a decision about a clinical trial. One quick thing I'll add is that there are some registry programs taking place. I know that there are some some centers, I know the University of Minnesota is one that is enrolling patients, not in like medication trials so much as research to understand the risks that our patients are facing, particularly those with kidney disease. These are really fantastic researchers at one of the best children's hospital programs in the country at University of Minnesota. I would encourage folks, if you hear about this, to inquire with your nephrologist about whether or not your child could enroll in one of these programs. And then there's other organizations like the Improving Renal Outcomes Collaborative that I mentioned earlier, who are also enrolling patients in a registry as well. So not quite like trialing medications per se, but we do want our families to be open to involving their children in the kind of research that is observational and will help gain data on how COVID-19 is impacting our patient population.
Great, thank you. Well, as our time comes to an end, I'd like to thank all those that joined us today, and I'd like to thank our panelists, Dr. Bignall and Dr. Mohammed, for taking time out of their day to have this discussion. For all those questions we did not have enough time for, and I know there are several, we will follow up with you directly within the next day or two. And if you would like to learn more information about the National Kidney Foundation, please visit our website at www.kidney.org. I want to thank our panelists again, and I want to thank everyone that joined us today. Have a wonderful day. Thanks.